Hello, PsychU community. Rachel Self here from the Otsuka Neuroscience Medical Affairs team. As many of you are aware, May has been recognized and celebrated as Mental Health Awareness Month within the United States since 1949. PsychU would like to join in the celebration and awareness efforts by hearing from many of our contributors and collaborators. I'm very pleased to be joined here today by Dr. Salvatore Savatta, Chair of Psychiatry for Trinitas Regional Medical Center, as well as PsychU speaker and collaborator. Dr. Savatta, thank you so much for taking some time to chat with us today.
It's my pleasure, Rachel. Thanks for having me.
So let's kick this all off by hearing from you. How do you celebrate Mental Health Awareness Month, and what does it mean to you?
Okay. Well, celebrate is a big term. I am involved in Mental Health Awareness Month, and I'm on one part I'm really happy it's nationally recognized. I saw earlier today, 2019, President Biden made it a national event, not just for the whole United States. So it's really great that we're getting all this awareness in mental health, and after COVID, the country is uniquely in tune that really anyone could be susceptible to mental illness, and mental health is important for everyone. It's not just for certain people, but for everybody. So that part is really great. And even when you look at media coverage now, you're even seeing success stories, not just people who suffer from mental illness and do bad things, but people who do great things, even though they have diagnoses. So it's really, it makes me happy to hear it. But, and the other thing, when you have an awareness month, it means that you're not where you need to be. There's a lot of work to do. We still have insufficient psychiatric access care for everyone who wants it and everyone who can benefit from it. So we need to expand the way we treat people, and also just be able to treat more people. And then also there's still a stigma. People who could benefit are scared. They don't come in for whatever reason, and we really need to address that. And then even some people who do come in, they get there, maybe they come for a session or two, but they're not really comfortable being there, and they drop out way before they can benefit. So it's great that there is an awareness month, but it's not great that we have so much work to do to really, help everyone who needs it.
Yeah, thank you. Those are fantastic points. Sometimes awareness just really highlights the barriers and the obstacles that we still have in our way, right? So thank you for sharing that perspective. So to extend upon that a little bit, could you share with us how your organization might engage in specific initiatives or undertake specific types of tasks during May Mental Health Awareness Month to sort of highlight that for your clientele and your patients?
Sure. So currently I'm the chair of psychiatry at Trinitas Regional Medical Center, as you mentioned. And, at the beginning of this year, we were merged with a much larger healthcare system, which is a Robert Wood Johnson Barnabas Health. And, that's 12 hospitals in the state of New Jersey. So we're a really big provider across the state. So when you're that big, you do focus on this year round, which is part of the reason why I'm here. And it's really great that we are, and we're all involved in all kinds of community initiatives. We work with peer support groups, we work with other agencies, governmental agencies. So it's something that we do year round. In May, we kind of double down. We do even more. We reach out even more, because part of the thing is, although we're aware 12 months a year, a lot of these agencies that are not pure healthcare providers, they focus on different things at different times of the year. So we have an audience, so we get to be more involved. And I spoke to some of the people who are in our organization. They have collaborative efforts with the mayor's office in Elizabeth, our community. So we're going to be doing some events with the community. So it's really a lot more about doing what we do with more exposure. But it's really good that we have that opportunity to work with other people, and they're also working with us.
Right. And there we're talking about experts in the mental health space and people who are well versed in engaging with mental health care and behavioral health challenges. To sort of sidestep from that a little bit, are there any key things that you wish the general public was more aware of regarding mental health and perhaps Mental Health Awareness Month?
So I do, and I don't know if I speak for everyone, but I think I do speak for a lot of the people that I encounter. It's really, we look at mental health as really mental illness and treatment of mental illness, but not as much as wellness. Really, the whole goal of mental health is not to say, well, I have a disorder and I need treatment, but to say, well, how can I do better? How can I improve my function? How can I get more happiness out of life? How can I achieve the goals that I want to achieve? What's standing in my way? And so I look at what we do as an opportunity for someone to work on these issues, not to treat a disease, but to really say, how do I get the most out of my life? And, if someone comes in and there's not, they don't need medicine, that's fine. They don't need medicine. We don't prescribe medicine. If someone needs a certain type of therapy, then we're happy to deliver that type of therapy. And, a lot of these therapies they're not disease-based. They're just on what is your problem, how are you going to confront the problem, and how are you going to get past the problem. So that's really kind of what I wish the public was more aware of. It's not, it's not about labeling people. It's not about identifying people with illness, but it's really more about giving people opportunities to work on the things they want in their life and really achieve their own goals, and just how we can be helpful in that way.
Thank you for that. Yeah, that it's definitely sort of a community effort, right? It takes the experts in the field, the general public, and having a better understanding as a community. So along those lines, I'd just like to hear, are there any specific things that you could share with our PsychU community today that all of us, whether we're not as in touch with behavioral health or the most esteemed expert in behavioral health, little things that we can all do to make a difference or raise awareness this month as well as throughout the rest of the year for individuals who are dealing with mental health challenges?
Yeah, no, that's a great question. And so I'm happy to take a stab at it. So, I mean, I think the real thing is we need to be honest with ourselves. First, you kind of have to think of yourself as someone who's at risk or can benefit, or just look at yourself as someone who functions in a certain way that maybe there's a way to get better function. No, not everyone, but it's okay to ask the question. It's okay to look at, why are we not getting what we want out of life? And is there a way to go about it in a better way? Once you start with that question, well, now then, maybe I can get help. Not that I need help, but maybe I can get help, and just start there and just be open to the process. And if you can think that way about yourself, then extend that to the people around you. Extend that to your family member, extend that to your coworker, extend that to your friends, and just be supportive for them. If they, help them come to a point where say, maybe there's a better way, and maybe you can try some ways to do better. But what does it cost? It just costs some time with a professional and really kind of some thinking about yourself, and that's about it. And and I think that's a good place to start. And that could be in May, and it could be any month really. But it's just it's good to pick a time to start.
Yeah, hopefully it's all year long. But yes, I hear you that a little introspection, honesty, and open-mindedness can take you a long way, right?
Yeah, that's said in very few words, but that's exactly what I was trying to communicate. Yes.
We appreciate that, and we appreciate you. So thank you for taking some time with us today and everything that you do out there in your community and for our PsychU community. Thank you so much. For our
Thank you.
audience, yeah, for our audience, thank you for joining us today. Thank you for sharing our experiences and challenges together. And hopefully we can all continue to work as a community to improve mental health care together. Thank you all.